All right, so it really is some good news for Kenya. Things certainly are looking up. And to delve deeper into really what this means for the country, I'm joined by two guests, one that will focus on the tourism sector and the other on health. Because remember, this conversation this morning is looking at those two sectors as we check in with 2019. So joining me in studio, Susan Ongalo, the CEO of the Kenya Tourism Federation, and beside her is Simon Karo. He is the CEO of Melchizedek Hospital and also Pathway International. Thank you both so much for joining us this morning. Susan, I'll begin with you. What are your sentiments about the latest news that tourism revenues have spiked? Things are certainly looking good so far.
Thank you, Smriti. I can only be beaming because actually tourism has taken an up curve, and it's a good news to start, especially the year. So it was so timely for these results to come out at this time of the year, and we can only look forward to greater numbers. We're just coming out of the 1 million mark. We've been there for too long, and now we are above the 1 million. We're making good steps in tourism, and I can say 2019 will be a good year.
All right, excellent. And Simon, perhaps I'll get you to contribute, even though your focus is on health. But, you know, as a domestic tourist or just generally as a Kenyan, what are your views about the fact that the numbers are looking up?
It's exciting to realize that Kenya is growing as a tourism destination, and even the local tourists are actually beginning to enjoy places like Mombasa, the Mara, Samburu. It's a beautiful country.
It certainly is. All right. Well, Susan, what are these numbers attributed to? Because, of course, over the years, Kenya has suffered a big hit, namely due to terrorism as one of the key factors that's been affecting the tourism numbers. What has changed?
When we start from terrorism and we look at 2013 especially, that was a very hard year for us. After picking up in 2011, then came 2013, which was just a damper. So what has changed is that the security awareness or the security measures have really been boosted. And once the perception that the country is safe, and when the travel advisories are lifted or even toned down, that gives the encouragement for tourists to come through. But not forgetting that there's been a goodwill in the political arena that also has driven the numbers up. And we just saw the recent handshake. And truly, the last quarter of the year has picked up for tourism because especially of that, there's no animosity and people are free to travel from one place to the other in the country. And then there are drivers like the infrastructures, the highways, the bypasses, the SGR. So there's a lot that has been done to boost tourism in all the sectors. And that's why we're recording good numbers. And good to note is that domestic tourism has really risen from a place that we were not even counting the domestic tourism. So domestic tourism has also boosted to the numbers. And we encourage, and you could have, as we had earlier before about the Murang'a County,
yes.
Who knew there was
Right.
anything tourism in Murang'a? So counties are a good revenue for tourism, especially looking forward in 2019. So we encourage inter-county, then we look into the region, inter-regional tourism, and mainly to focus on the continental. If we have the Africans traveling within each other African countries, then that will really bring the numbers for all the countries, not only Kenya.
Right.
But if Kenya does well, then Uganda does well, and Rwanda does well, and the other countries in the East Africa. And not forgetting that it is within this time that we had a single tourist visa running, and that single tourist visa was for Kenya, Rwanda, and Uganda. And that, I would say, in my view, also spiraled the numbers up. So those drivers have really pushed the numbers. And the charters, the incentives, there's a lot that has been going
Right.
between private sector and government. So
Okay,
yeah.
but which areas are still peaking in attracting tourists? The key focus over the years really has been the coastal region and, of course, the Masai Mara, for example. Is the country looking at expanding in different ways and attracting tourists to different destinations, such as perhaps Murang'a?
Well said. Yes, we cannot do away with the products that were there. The traditional products have to be there because otherwise we can't put them down. But looking at the recently launched the blueprint, the Tourism Blueprint 2030, it has other areas. And our focus especially is the mice business. We had a Skull Congress that came in October. Then we had other conferences happening, and we have hotels coming up. All the chain hotels are opening, looking up in Kenya, and actually Nairobi has a number of them. Marriott is coming up. And the shopping experience, and we have the national park just up the road in Langata. So there's a lot that is happening aside from the beach and tourism. But truth be told, still beach will still take its place.
Sure.
And the domestic tourism, especially the Kenyan tourists, is now looking out to tour their countries. In fact, the Tembea Kenya, when I look at social media, a lot of Kenyans are saying Tembea Kenya edition, this place, this place. So Kenyans themselves are also beginning to speak about their experiences. So I'll put it more on experience, because if you don't have a good experience in a place, then you're not able to talk about it. And then social media has really, digital has brought a lot of marketing, which I could say it's almost a free marketing, though it can have its own demerits, but merits have also been realized. So that's what I would attribute.
Okay, excellent. Simon, what's your contribution?
My contribution would be that in addition to all those sectors of tourism, there's also the area of medical tourism, where we're beginning to see an influx of medical tourists coming to Kenya, as Kenya is becoming one of the most developed in the region as far as medical care.
What is a medical tourist, though? How do you define that?
A medical tourist is somebody who would seek treatment outside their country, and it's been going on for thousands and thousands of years.
Right.
I know we know a lot of Kenyans are actually traveling out to places such as India, South Africa, Malaysia, and so forth. But right now, Kenya has positioned itself in the region as a leader in healthcare. With our hospitals, for example, a hospital like Aga Khan has invested in something called what we call a PET CT scan, which is one in the region, one of the only in the region. So patients are coming in from places like Uganda, Tanzania, Burundi, Rwanda to come and seek treatment here. And when they come to seek treatment, while they're here, they'll be able to now, it spreads out to the whole economy. They'll be looking for accommodation, places to eat, places to travel, as with the attendants and so forth.
How interesting. Who would have thought that that there is a link between the health sector and the tourism sector in that respect? All right, with me still in studio, my guest, Susan Ongalo. She is the CEO of the Kenya Tourism Federation, and also Simon Karo. He is the CEO of Melchizedek Hospital and Pathway International. Thanks for staying with us. Let's move on briefly from tourism to health. And Simon, before we crossed over to Mombasa, you talked about, well, health tourists. But how would you define the health sector as we closed 2018? And how positive are you about what it looks like ahead in 2019?
Thank you, Smriti. The health sector in 2018, I'll start off by saying, first of all, your health is your wealth. It's like Mahatma Gandhi is more valuable than gold or silver. The health sector causes a lot of financial constraints to a lot of people, and it's driven over 1 million people below the poverty line. It's also driven, most people, the constraints that are caused by healthcare drive people to almost financial ruin, specifically the poor. And as we close the year on December 13th, our President Uhuru Kenyatta launched the UHC, Universal Healthcare, which is called the AFIA program, which is supposed to cater for all cadres of people, specifically the poor. And he launched it in 4 counties. So that was a good step. We launched it in Kisumu, launched it in Nyeri, Isiolo, and Machakos. And those counties are actually the pilots. They'll be rolled out to the other 43 counties within a year. So those counties were selected for various reasons. And as we closed the year, that was a positive sign that things are going to change. And the Big Four agenda, specifically health, is being addressed. And we're hopeful by 2022 to be rolled out and successful. Obviously, it's still at infancy stage. It's a baby, it's not crawled. It's still growing, and there's still a lot of work to be done as far as implementation, ensuring we engage the appropriate stakeholders to ensure that Kenyans actually receive primary health care. And the focus of UHC is to provide primary health care.
All right, but as you say that, earlier you mentioned that more and more people are coming to Kenya for treatment. What therefore has changed? Because, well, in the years, as you said, many Kenyans tend to travel abroad, either to India, South Africa, or the UK for treatment. So where's the positive aspect in that regard?
The positivity is that there's a lot of development investments that are happening in Kenya, specifically in the private sector, where a lot of companies, whether they are foreign companies, foreign countries, are coming into Kenya and investing in the healthcare industry. Whether it's hospitals getting acquisitions, mergers, private equity firms are really investing in hospitals. So the infrastructure is really improving. The infrastructure of healthcare in Kenya has truly improved. But has it trickled down to the grassroots? It does not trickle down to the grassroots, to the poor. This affects or assists people who are able to afford treatment, who have insurance that is able to cover for the treatment. And the people who are coming in are obviously people who can afford the care that is available, because healthcare, like I said, is a very expensive affair, specifically in Kenya.
So for the less privileged, are you saying that the situation still remains bleak and dismal with regard to healthcare? Access to it?
We still got a long way to go. Right. We still have a long way to go. It's still bleak, but the future is looking bright with some of the initiatives that are being put in place. If there are proper reforms, specifically in some of the institutions, proper institutions, and the money actually trickles down to the poor, some of the institutions such as NHIF, the money should definitely trickle down to the poor, vis-a-vis ending up in people's pockets for the individual gains. So and obviously the government is working towards ensuring that happens. So we're looking forward to a better future, and primary care is available even in private hospitals. NHIF covers for individuals who can't afford in private hospitals, such as the Melchizedek Hospital, where you can be able to access quality healthcare at very affordable prices.
Okay. Simon, we were talking about the fact that really health care needs more attention at the grassroots. And you touched on the point about money meant for health institutions or the industry and it perhaps reaching other people's pockets. Is corruption a big factor to blame for poor health in the counties?
Well, corruption definitely plays a role, and it's definitely a disease that has afflicted many institutions in Kenya, and that's the reality on the ground. For these 4 counties, for example, 32 billion Kenyan shillings has been invested just for the 4 counties, the 4 pilot counties. We still need to roll out 43. So if you do the math, there's still a lot of money that needs to be invested into the healthcare. So at the end of the day, we need to curb corruption. Sometimes the money does not reach the intended users, which is unfortunate, which is a sad fact.
Okay. All right. Of course, that requires will from all Kenyans, be it politicians or your average Kenyan who is engaging in corruption. Susan, I'll bring you into this conversation about health. What are your views? And no doubt there is also a connection between tourism and health, because if tourists are holidaying in Kenya and need medical attention, health facilities really ought to be up to par for, well, of course, Kenyans, but also for tourists as well.
Yes, you're right. Tourism actually and health goes hand in hand. And medical health, especially when we have an outbreak, as tourism we suffer because everyone then asks if there's an outbreak of this and the other, and maybe Ebola or even malaria. You find that the numbers that will travel, then there's an alert, don't travel, because if you contract malaria or something like that, then you're in trouble. So that affects directly the tourism movement to Kenya. But also looking at the positive side, I would say, because of the medical tourism, there's need to improve facilities, the health facilities in the country, so that we can not only attract the regional, but even the Africans, just the same way Kenyans would prefer going out there, though that has reduced, I think, a bit. It will also be attractive for our neighbors to come here as the hub of tourism, not only for the private medical facilities, but even the public facilities. There should be a referral hospital in as many as counties as we can get, so that then we don't have everybody going to Kenyatta or even Mama Lucy. Or it could have facilities that are country, and there is a lot of medical everywhere, so that when there's a specialty that one wants to look for, then they can go to that particular county. And looking at the issue of the doctors that had been mentioned on the clip, you look at, yes, the doctors were important, But for me, I'll look at it, is this a potential tourist?
Right.
Even as they're doing their work,
Yeah.
are they touring the country? So that's why I said they go hand in hand.
Right.
So that would be my contribution into that.
Okay, and the fact that we are recruiting doctors into the country, there is of course a positive angle to that, as Susan has said. But what about our own homegrown doctors? Where are they?
We definitely have a very good crop of doctors locally in Kenya. But just to touch on the Cuban doctors,
Yes.
50 Cuban doctors were imported to Kenya, and they came in with various specialties. And they're definitely making an impact and doing some good things. For example, you'd be surprised to find an endocrinologist in Wajir or a radiologist in a place like Isiolo.
Right.
Where places you would have never thought to find such specialties. So Cuba has really helped, and it's been something they've been doing since the 1960s, since the revolution. They've been actually exporting doctors. Believe it or not, as we touch on tourism, for Cuba, it's the highest foreign honor for the country.
Oh,
It's
wow.
Yeah, they export 37,000 doctors to 77,000 countries, earning $11 billion.
Oh, wow.
So it's number one.
Big
Tourism
numbers.
is number two.
Yeah.
So they've been doing this for a while. But the program for Cuba, they've sent 50 doctors, with another 50, I believe, who are going to be coming soon. But they've also taken 50 of our local doctors to train, upgrade their skills, so they can also improve on their skills. But locally, we have a very strong local fraternity of doctors. The only issue is that we don't have enough. We don't have enough doctors. The World Health recommendation is 1 doctor to 300. In Kenya, the numbers vary, but I had the president say it is 1 to 16,000.
Wow.
That's a big, and the Kenya
Yeah.
Medical said is 1 to 6,000. But regardless, the gap is huge. In a place like
Why
Cuba,
do we have that gap? Where are the doctors? Why don't we have enough?
we don't have enough. We need more.
Why not, though? Is it because there's a lack of interest in, people studying the profession and getting into it? Is it an issue of poor pay? Where are the key problems?
It's a mix of everything you've said, Smriti. It's a mix of the numbers, and it's a global issue. With some countries doing well, like Cuba is 1 doctor to 150, but Kenya, again, the healthcare workforce needs a lot of work. We need to improve on the healthcare workforce, and that's one of the reasons we're getting some of the Cuban doctors to come into Kenya to help fill the gaps that are currently existing.
Okay. All right, more on health in a moment. But when we spoke about tourism, it was very positive. But what work needs to take place in the tourism industry to keep improving it and taking us to higher levels? We have, of course, come a long way, but we still no doubt have a long way to go.
Okay. I would say work that needs to be done is to start from the policies that are there, improve on those, and look at which needs to be dropped, which needs to be improved, and which needs to be brought into place. Because issues of ethics, especially, can bring down the economy, the tourism economy, just like that. So we need to have ethical operators on ground, and we need to have standards, and we need to benchmark on those tourism destinations that are doing very well. And when we stand alone as Kenya, we cannot do much. So I am a strong advocate of working with other people, working with the neighbors, working with the regional blocks that are there to improve. Because if we improve another person's place, then you improve yourself. If I improve your outlook, then I'll be improving myself in the place. So I would say, because Kenya, especially with hotels and maybe services, the cabs, everybody that is a stakeholder in tourism, even the government itself, should have standards and ethics that work towards improving and making the experience of the tourist even better. Because one tourist then comes and suffers, let's say, theft, or someone snatches a bag, or then that brings a very serious detriment to the economy, the tourism economy. But also speaking, even the roads, the traffic, the policemen on the road, we need to give that preference to the tourism. And not to say that the tourist driver can behave the way they want, but there is need to have that courtesy and service that this tourist is treated as a worth of money that they've put in the economy, and also, as we are treating the international tourists very well, we should also treat our very own domestic tourists well. Not to check in into a place and because you're not looking like the other one,
Right.
then I don't give you equal service. Service should be service to all.
Right.
So service and experience go together. So I would say those are the things that will improve the economy. But infrastructure as well. More charter flights, more flights landing into the country. It doesn't matter which airport, it should be spread. It should be Mombasa, it should be Malindi, it should be Ukunda, it should be Kisumu, Eldoret. Opens up the country. You've just spoken about the Cuban doctors up there in Mandera. It is a, did people know there is a cradle of mankind in Turkana? So it is a way of opening up the road or the travel to those areas. As you're going for medical or you're going for a health checkup in that specialized place, then you're also getting to cure. Maybe you can even cure in the nature, who knows. So there's a lot in the country that we can tap into. There's a lot of potential in the counties. And I would say if we concentrate in what we have before we even bring add-ons, then that will keep the graph going up. But also looking at other areas, the culture, the sports tourism, even the health tourism, we need to look at it seriously, continue our conversation from here. How can we then tap those numbers and count them as tourism? Because I believe those numbers then are not counted as tourism. So there's pockets here and there that are lost. So I think tourism is actually doing much more than is being reported.
Right.
And there's a way that we can improve and even double the numbers.
And on the issue of customer service, how really that is critical in all sectors to improve the customer experience. What exactly is being done to make that improvement?
I'll touch by last year, JKIA. There was hue and cry at JKIA. So the CSs met and all the staff at JKIA received training on customer service from Utali College. So, and that's why we are reinforcing the customer service. We want from touch point, from the gate to the check-in, to the plane. It should be the same. It should be seamless. So that is one step that thing is already happening. The training is already happening. People are already being trained on customer service and retrained because sometimes staff keeps turning and there's high turnover or there's just new staff coming in. So that training should continue. And not only at JKIA, in all the other parts where service is given. KWS, for example, they have their customer service at the gate or wherever they station them. Then we have, even in our own private sector places, we should have the driver guides trained on customer service, the hotel staff trained on customer service, because the first impression, and I dwelled on JKI or the airports because that is where the customer touch point is at first. So if there's a bad experience or there's a bad impression the first time somebody gets into a country, then that spoils the whole mood.
Sure.
Or maybe you've enjoyed yourself the whole way and then you're going to leave and then here, it just waters down all the experiences that one has experienced. So that, I would say, customer service is really key. You could have good roads, but the person that is using that road is really
okay.
not good.
And of course, there can a link can be drawn to customer service in the medical field as well. When you go to a hospital, for example, or for a medical checkup, you want a good customer experience, especially if you are, experiencing poor health. What's your take on customer service in the health sector?
I think customer service, as Susan has mentioned, is critical, not only in tourism, but also in medical. The way you treat a patient, they'll immediately start feeling better. The way you smile at the patient. The issue is what doctors used to be like semi-gods. They were feared, revered, whatever they say. Now, these days, doctors are engaging patients. They're touching the patients. A bit of touch gives them comfort, not just prescribing a prescription by just looking at you. So doctors are actually engaging their patients. And from the gate, from the laboratory, the pharmacy, that whole experience begins a person on the road to recovery.
But are we getting that positive experience in our hospitals across the country?
I would say in private healthcare, definitely it is.
But not in public.
In public, we still need some work to do. Maybe the trainings we've mentioned, we need to have more trainings in the public health sector, and realize everybody needs to be treated equally,
Right.
depending on your background. It doesn't matter where you come from, whether you walk in, ride a bicycle, come into the car, come into the Mercedes-Benz. Every human life should be treated equally and with the utmost respect.
Right. Susan Muranga, I think you do have some work in perhaps marketing the counties as well, more than the typical tourist destinations. Don't you agree?
I agree, and also say that this an exercise that was done, I think 3 years ago, 2014, 2015, about product mapping in all the counties. And I think that report was not brought to implementation. So maybe we could begin from what we have and then on the added, because I believe in the counties we have very many sites and a lot of experience that just listening to Muranga County, there's a lot to do there. In fact, it's a week's expedition. So I think we have some work to do there. And this is an initiative for both private and public. Right. So it's county and the private sector operating in that county. And as KTF, being the umbrella body for tourism, the private sector, we are willing to engage.
All right, so certainly a challenge for you to look into marketing various counties. Okay, Simon, let's go back to the health issue. Looking ahead in 2019, how positive are you that really things will improve for the country and for Kenyans as well?
The narrative is still being written. So I'm optimistic, I'm positive that the end will definitely be a means to see what we can accomplish. But as Kenyans and as the government, we need to develop a very resilient and responsive healthcare system that truly meets the needs of Kenyans. But most importantly, as we've spoken so much about curative care, I'd like to step back and say that we do need to start focusing on preventive healthcare.
Right.
We need to get the patients, treat people, educate homes, villages at the homestead, not necessarily at the hospital doorstep. We begin education and prevention. So to all Kenyans out there, I would highly encourage you to go get treated, go get diagnosed, go for annual checkups and so forth. And non-communicable diseases, I've not spoken much about them, such as the cancers and so forth. They're treatable if detected early. One of the campaigns that Pathway International is running is early detection saves lives. For example, in women, breast cancer and cervical cancer, treatable when caught early. And this should be done on an annual basis. For men, prostate cancer. If diagnosed or you're getting looked at every year, it's treatable very, very early. Same thing as liver. The liver, when people get a liver disease, they think it's a death sentence, but it's not a death sentence. If you take care of your liver, if you go see the right people at the right time, there's hope. There's a lot of hope, and people like Pathway International are able to assist.
No doubt. Yeah. All right, and when we talk about universal healthcare, does Kenya's economy have the sufficient muscle to execute universal healthcare?
Definitely, we need a lot of development partners to step in and assist. The economy is not where it should be, and what is set aside in the budget annually is not enough to cater for all the needs. So, for example, the 32 billion I referred to earlier that has been set aside for the rollout of the pilot was actually a gift, I think, I believe, from the WHO, Japan, and also the World Bank. So, developed partners are encouraged to come and continue assisting Kenya be able to achieve its goal of achieving universal healthcare like other countries in the world.
Okay, and Susan, when we spoke about tourism, touched on the issue of policies. I'm still with you, Simon, on the issue of policies. Perhaps what 2 or 3 policies should be implemented in order to improve the health sector this year?
This year, I would say 3 things. Number 1, institutional reforms, and I think we've touched on that.
Yeah.
We definitely need to reform some of our key institutions, beginning with NHIF, to ensure that there's transparency and there's greater coverage. Number 2, I'd say maybe we have the healthcare workforce. A policy, we definitely need to continue developing our workforce, as we mentioned earlier, there's not enough trained and qualified workers, and encouraging people who are outside abroad to come back. The same model like India used. The people who are working in the UK, the US, we have brilliant doctors working in the US and the UK and so forth. We encourage them to come back, give them initiatives and encouragement to come back to the country. Right. And lastly, more engagement with stakeholders. The government has been moving quite unilaterally in some of these decisions, rolling out the universal healthcare without necessarily involving some of the private hospitals, not involving some of the key associations such as KMA, KHF, and so forth. So more consultative approach to healthcare would definitely see us having a brighter outlook in 2019.
All right, well, let's certainly hope so. And Susan, back briefly before we close to the issue of tourism. We talked about the role that the Kenyan Tourism Federation has in improving or marketing tourism in the counties. But how critical is it that the county governments themselves play a role in marketing their counties, or at least, you know, doing whatever they can to sell?
Okay, first of all, I'll correct that and say the Kenya's marketing arm is the Kenya Tourism Board. Okay. And that's the the government arm of marketing. But the private sector under KTF has also a role to do, because we're the owners of what we have, the business and the product. So I would say counties, they have a huge opportunities to hop on to the initiatives that KTF is doing. For example, last year in November, we had a private and public organization, the counties actually, and the private sector tourism players. We had an expo that we attended in London, and that really brought out the counties out there. There were only 2-3 counties, but we're looking forward to such partnerships, because that is the only platform they can use to bring what they have out into the market. But not to work without KTB, because KTB then is what will consolidate what each county has. And as I mentioned, the product mapping, there's a directory on products on which belongs to each county. So that is a tripartite I see right there, the counties, KTB and KTF. If we have that working together, I am sure we are going to bring out more products that we will even imagine we have in this country of ours. So counties are welcome. We really wish that the county executives will engage with the two bodies, KTB and KTF, that we are able to bring out what they have into the market and not just sit with it and say, this is ours. As I said earlier, once you share something, then you're growing yourself as well. So that is what I would like to extend out there to the counties. You've heard what the county of Murang'a, it was really well presented. Right. They're bringing out and saying, this is what we have and what can we do together with it. Right. If the other counties came out, and even if one county doesn't have much, they can merge within the region. Sure. How many counties we have? You have a mountain, we have a river, we have. How can we then make a product out of all that we have? These are natural resources given to us by God. Yeah, nature
most definitely.
Us.
All right, and just looking at the numbers, I quote the Daily Nation. Last year's numbers of international arrivals stood at about 2 million compared to the 1.4 million in 2017. That's an increase of 37.3%. What are we hopeful for in 2019, realistically?
Am I allowed to dream?
Of course, you can dream.
I would say international arrivals will only look to double. Okay. Because all the parameters are in place. There's incentives. There's planes landing. There's charters. There's cruises. So there's all the infrastructure has been laid down. So we can only double the number. But also, looking at the other pie, there's a domestic tourism that we can take up to 60%. And the advantage of domestic and regional and African tourism is that we are used to our own climate. So there's really no fear that there'll be Ebola in Congo, for example. We have that adaptability. So we grow international, but let's also nurture and focus a bit more on the domestic tourism.
And what has changed to improve domestic tourism? Because no doubt it has improved. Have destinations become more accessible and more affordable for the domestic tourist?
I am not so sure about affordability, but I would say that the awareness, the bringing out of what is there for the domestic person to consume. That, I think, the awareness has created the interest. And then also the mode of travel. There's local airlines that are doing Kisumu, Nairobi, Silverstone, for example, Malindi and all that. So there's also something that is encouraging people to travel at a good rate. Okay, you said pricing. Yeah, pricing matters. So that, if I can sit in my house and think I want to go to Ukunda and I can go there affordably with my family, and then the rates are given at the hotel are not exorbitant, then I'll consider a holiday in Mombasa. So pricing as well, pricing product and all that then has spurred domestic tourism and also awareness. But I think awareness is most of it, of what has made people travel.
Right, and
KTB gets the honors of doing that in Kenya.
Yeah, and of course, as you mentioned, social media, Instagram, things like that have made a huge difference. Simon, are you planning to travel locally this year?
Absolutely.
All right.
I love Kenya. The beautiful sights. The Wazungus come, but what do they come to see? We have it right here.
Of course. All right. All right. So a positive outlook generally from both of you ahead of 2019, but of course still, as always, lots more to do in those certain sectors. All right, Susan and Simon, thanks very much for joining us on NTV today. It's been a pleasure.